Good afternoon, everyone. My name is Lucy Wheeler. My pronouns are she, her, and I'm an arts producer in the CUH arts team. I'm so delighted on behalf of CUH Arts to welcome you to this webinar, which is entitled Dance in Acute Settings, an Introduction. And I'm really looking forward to the rich conversation that's going to follow. So I'm going to start by giving a very short introduction before I hand over to our panelists for today. So I wanted to just talk very briefly about who CUH Arts are, and then hand over to Miranda, who is chairing the session today. So if we could go on to the next slide, please, Annie, that'd be wonderful. So CUH Arts is Cambridge University Hospital's Arts in Health programme, dedicated to sharing care through creativity. We strive in our team to humanise health, inspire hope and promote well-being through a diverse programme of live and participatory activities, art commissions and activities. And on the screen here, you can just see a number of the ways that we do that through our CUH Creates programme, where we bring artists onto wards, through commissions where we have artists working alongside clinical staff and patients to develop new artworks, as well as bringing music and movement to the wards, and working on creative engagement projects for new hospital sites to really integrate the arts into the healthcare that we do across our different sites. This year, we've been celebrating 10 years of our Dance in Health programme, of which this webinar series is a really key part. We can go on to the next slide, please, Annie. Established in 2014 and led by the fantastic dance artist and lead artist for CUH, Felipa Pereira-Stubbs, Dance for Health is a collaborative participatory programme for inpatients on wards at Cambridge University Hospital. Its aim is to bring staff, patients and visitors together in dance and movement to promote well-being, aid physical and mental recovery, and encourage increased social interaction. Over the last decade, the programme has become an important part of the culture at CUH. It's embedded in ward culture and integrated into hospital life. The space it occupies in the day-to-day life of a very busy teaching hospital has solidified its position as a leader in the field of hospital-based participatory dance. And this webinar series has been a long time coming, as I'm sure Felipa will share. We've been thinking about how we share some of the quiet work that we've been really beavering away at day to day, week to week in hospital. And we also want this to become much more of a national conversation about dance and movement in hospitals. So the webinar series is really about bringing together and opening up conversations between dance practitioners, dance artists, clinical research colleagues. And we really hope that this acts as a snowball to create a network of diverse professionals sharing dance in hospital best practice. In this first webinar, what we really want to do is unpack what dance is and how it can be in clinical settings, what impact it has, how it complements the clinical model and enhances the culture of care in hospitals, and to articulate the language and principles of dance in hospitals and the critical role it can play in patient and staff experiences of the hospital now and in the future. I'm going to stop talking and I'm going to hand over to our chair today. We couldn't have asked for a better chair, and that's Miranda Tufnell. Miranda is a dance artist, writer and teacher in movement and imagination. Throughout her career, she has been pursuing a profound interest in the body, environment and the language of movement, often in collaboration within healthcare settings. We're so incredibly grateful, Miranda, that you're here today. And I want to warmly welcome Felipa. I'm not sure where we are, Annie, with Kai currently.
I'm afraid we're still having the same issues where Kai is able to join visually, but not join with his audio, which is really frustrating. But we're trying to find a solution.
Okay. Miranda and Felipa, are you happy for me to hand over and we go from there? And Annie and I will be working in the background to try and get Kai in the conversation as and when.
Thank you. Yeah, good. Let's get started. Well, I have to say I'm very honoured to be part of this because, you know, I'm not working in hospitals myself. And I want to sort of start by, there was a Peter Cook made this wonderful remark years ago. I always wanted to be a judge, he said, but I hadn't got the Latin. And I think when one mentions the word dance in hospital settings or in health generally, there's often you can see what goes on in people's minds. What does this mean? Philippa and Kai are two artists that I admire hugely in their practice, extensive practice over many, many years in hospitals. And I've had the pleasure of visiting them and talking with them over years. Philippa came up with this phrase. She said, "What is this pill called dance?" I thought that was the really wonderful. What is dance? What is dance in these settings? And what are the skills that are needed in order to bring health, vitality, to strengthen a person's resources? What are the skills that we as artists need to bring? And I have to say, I'm in awe at what's happened in my lifetime. How many dancers are now involved in this work? My own work, as many of you may know, has been in general practice. I worked across GP surgeries in Cumbria and Northumberland. And at that point, the doctor said to me, "Can you help my patients not experience themselves as having failed, that their body is an enemy that they have to battle with?" And I pondered that for a long time, feeling that we dancers, anybody who's got a dance training, and particularly with a somatic training, there is a knowledge in there that helps people settle into themselves and enable the flow of life to come back. I think of dance as being something that opens the door back into yourself when it is so easily lost in the experience of illness, and particularly in a health setting. So I don't want to witter on from my perspective. I'm sort of here to kind of ask more questions, to bring out the incredible knowledge that Philippa brings to this work. And Kai, which I hope we're going to be able to hear. So Philippa, I'd like to ask you to maybe to begin by just telling us a story of one of your encounters. And I always find that one of the man who couldn't get out of the hospital had given up with. But it could be any story that you want. And then track back from that into how you got into this work. And then we can get into the skills and principles. And
okay. Thanks, Miranda. Yeah, and hello, everybody. I'm seeing some names come in, and it looks like people are coming in from all over the country, which is really fantastic. This is really just the beginning. I really want to say that. It's delightful that CUH Arts could host this time, but there's going to be more of this and more conversations because, as you say, Miranda, this work is growing in my lifetime as well. And my great hope is that before I die, that a dance artist is in every hospital in post with a pension and a contract. So we are just beginning this conversation. Please join in, ask us your questions. We wanted this first webinar to be really open and spacious. I'm going to start with a story because Miranda's absolutely right. People often ask, what does this mean, this dance business in hospital? And the stories can really illustrate that. So this is a gentleman who was on C4, which is the Department of Medicine for the Elderly. And he was brought to our attention, my attention, as the Dance for Health's lead artist, because of his incapacity to engage with his treatment on the ward. And he was beginning to deteriorate at an alarming pace. He was not getting out of bed. He wasn't agreeing to any of the therapies, OT, physiotherapy. So we persuaded him to attend one of the sessions that we were leading. This is about sort of 3 years into the beginning of the program. And we assured him that he was welcome as he was, namely depressed, morose, suspicious of us. And with quite a bit of difficulty, he was brought in a wheelchair, and he sat on the very edge of the group. He couldn't be closer to the door. He was going to bolt at any chance that he possibly could. So our language in that session was particularly gentle and light and spacious. And I think something that Kai, Miranda and I have so often talked about with many of you as well is the importance of the language in translating that medical objective body use to a sensed personal understanding of what it means to be in a body in a hospital. I really carefully watched him, and I watched his physical responses to the songs, and I noticed when he responded with a particular brightness to one track. And I carefully drew him into participating in the group by asking him to DJ the next choices, and he agreed to do that. So in the role of the helper, he agreed to take someone's hand, my colleague, the falls coordinator at the time. And he found comfort in that touch, and he felt engaged with through his musical knowledge. Most interestingly, he allowed himself to notice how much the other participants were getting out of the session. This is group work. This is so social, this work that we do. It's not just about ourselves and our self-healing. It's how we open ourselves up into the relational field between patients, staff, family, everybody who works here. So based on witnessing their enjoyment and their physical change, something shifted in him. Some door opened and a way in was found, and he began to join in with the movement. He began to attend the sessions. He not only went on to attend all the sessions, he then became a really keen ambassador for the sessions, urging others to join in. He'd be up and down the hallway telling people they had to come in and do the movement. Now, here's the thing. This transformation was not only noted by the consultant, but it was remarked upon. And I'm going to read the consultant's words out to you. Recently, I had one of the most complex medical patients I have ever had on my ward. He had a number of issues which interacted, and due to his high symptom burden, had a large impact on his mental health. He was extremely low in mood and struggled to engage at all with the medical, nursing, or therapy teams. He reached a point where he required the assistance of two and was essentially confined to his bed. We had explored pharmacological therapy with the psychiatrists, but nothing had helped. We were, in fact, looking to find a suitable nursing home placement given his high needs. However, he was encouraged to join the music and movement group, and following this, there was an almost miraculous improvement in all facets of his hospital stay. It meant his mood was lifted dramatically after 3 months in hospital, and he was willing to try again with his mobility. He went from being bedbound to mobilizing independently on the ward, and he has since been discharged to inpatient rehabilitation. The patient feels strongly that the movement and music sessions were one of the core therapeutic interventions he benefited from. So the beauty of this is it shows how complex it can become, particularly on the Department of Medicine for the elderly wards, where patients come in with a multiplicity of needs, but how difficult it is when they no longer feel there is a way for them to join in their care, where there is meaning in joining in. And the great sadness in this gentleman's case was all he really wanted was to go home and be with his wife. And that was becoming more and more impossible as he struggled more and more with the care that was being offered. So it's not to say that this miraculous dance business saves us all. We all know how complex and how carefully we structure these music and dance sessions. But what it did is it allowed him to find the spark that then allowed him to receive all the other work that was being done on his behalf on that ward. And it was noted by the consultants, and they loved that this program was made available to them. So that's a first story.
there's something about getting out of that box of illness, isn't it? Because you didn't say, I'm trying to help you do this, that, and the other. You just said, come and join some music and movement. And that opening the door back into a sense of self, I think, is absolutely, who am I? That's what we lose when we go into hospital, and we are boxed in with our diagnosis. So it's opening that box. How did would you want to say something about how did you come to this? How did you get this going in the hospital?
So I've been working in dance and health for about 30 years now. Started off in the psychiatry of old age in Hackney in Homerton, back in the day when dementia was still seen as a mental health illness and not the disease that it is. Subsequently to that, I realized that a lot of the psychosomatic work that I had trained in as a movement therapist didn't really work on acute busy wards. And I slowly shifted my role into being a dance artist, which simply meant that I was able to be more flexible, more adaptable in my approach. And if there's one thing that we need in this work on acute wards is adaptability.
Absolutely.
Flexibility. Many of you will know, working in hospitals, that you will arrive and the ward is shut down for COVID, or you will arrive and somebody has just passed away in one of the beds. You can't go in with the Elvis songs you might have thought would be appropriate to the lady in the corner who loves Elvis. So what do you do? How do you shift? And that flexibility, that creativity, the ability which Kai talks so beautifully about, to bring the studio space to the bedside and engage with the here and now, that is the work that I began to become more and more fascinated by, and was running a community group in Cambridge, where I'm based. It was for people living with dementia, but the premise was that everybody joined in, the care workers, the family, everybody joined in. And of course, the nature of dementia is that members of the group got hospitalized, they got ill, and I found it really frustrating that they would go into hospital and I couldn't follow them in. I couldn't go in with them and continue the good work, because the regularity, the engagement was doing wonders for the community. It was rich, it was engaged, people were doing really well, having a great time. They'd come back out of hospital and it was almost like there was a ghost of themselves there. So I became increasingly interested in, how do I get into the busy ward setting of an acute hospital? And CUH is also a teaching hospital, so it's also a vast hospital. It's about finding a way in. My way in was the head of arts contacted the falls coordinator, who happened to be somebody who was not only extremely good and passionate about her job, but was also a dancer in her own right, albeit ballroom dancing. It took us a while to find a way of working together, for her to understand that ballroom dancing wasn't the only dance form, that actually this work was much more improvisational, quieter. But we became a good team. And in the early days, one of our most difficult issues was persuading staff to allow us to work with patients. There was a lot of, that's a lovely image there. That's actually somebody on their bed, in their bed, just receiving the music and finding peace, that sort of business of self-regulating. Often we would start off in groups, and people would bring the patients that were jaunty, perhaps on their way out, had a tap dancing background, and we had to slowly convince the staff that actually it was the people who were quieter, perhaps the people who looked a little bit depressed, perhaps the people who had falls but could still engage in some way. And I think testimony to the beauty of this program, and some of us here today have also been able to work for a long period of time in the same setting, is that as the years roll on, as the weeks, the months roll on, this program has become embedded on the ward. So when I arrive, it's no longer, oh, it's the dance lady, get your tutus out. It's now more a matter of, let's speak a bit quieter, let's close some doors. The consultants will come in, they'll see that I'm there, they'll wheel back out again and say, we'll come back, we'll let you get on with what you're doing. So it's sort of like this ability to bring the freshness of what movement does, how it engages the body, has been really well established. And then the only thing I want to say to add to that, Miranda, is that the beauty of this work is that it works across the hospital. So I'm working in rehabilitation, stroke, diabetes, endocrinology, pediatrics, Department of Medicine for the elderly, and the nature of this improvised, listening, touch-based work means you can engage people at any stage, at any age.
That's wonderful. That's so great to hear your story, and really, really helpful. I'm sort of thinking, when I think about what the skills are that you need as a practitioner, I'd love you to talk a little bit about how you listen. How do you? Because I expect everybody who's here has different way that, there are 1,000 ways of dancing and 1,000 ways of listening. And I'd love to hear a bit more from you about how you attune to both the context and also particularly when you're working one-to-one. Can you say something about that?
Sure. I might just start off with reading out a quote that I have from a lady who I was working with on the diabetes ward. She was a retired nurse, and in her retirement rediscovered her love of dance. And so when I went over to work with her one-to-one, it was a very small four-bedded bay, and all the ladies on the bay are wired up to have their hearts constantly monitored, so that this sort of beep, and this some of you will recognize this, that beep sound, and then there's this alarming little kind of heart with the rate of heart going up and down, and you kind of partly watch that the whole time. But she said this, I asked her about her precise dance, exquisite gesture. She was just like this absolute, it was almost like she was eating, savoring her delicious movement. And she described the process, which I will then talk into. She said, I'm doing something really, really small, so that my mind is looking at something very, very small and concentrating. And I'm not just throwing my arms around the place. I'm just using the music slowly, very small to begin with, and slowly, like a flower opening in a way, she described. Really, I'm just looking out into the world as a child, waking up, looking around, thinking, am I alive? This is what my movement is saying. It's saying, am I alive? Shall I stay or shall I go? And perhaps when you stop using small and then you do open your arms out wide, you think, I am glad to be alive and long may it last. And yes, and yes. So I think it's that thing that this lady encompassed so beautifully in her description of her process is we start small. We start with where people are at. And as dance artists, as somatic practitioners, we have done so much work to understand how our bodies work in relation to others, in relation to our own weathers, storms, moments of brightness, moments of difficulty. And we use our body as a tool, as a listening vessel, really. We are lucky in this work. I am lucky in this work in the sense that I don't have the same time pressures that the rest of the team have. I can draw up a chair. I can pull somebody. The gentleman on the left there, you can see his chair has been pulled away from the corner. The man who's standing behind the wonderful dancing person, because often you go to a ward and everybody's just been shoved into corners and the curtains are drawn and they can't see each other. So the first thing we do, really, Miranda, is we look. How are you? We engage. We introduce. We start to listen to who the person is. It's that wonderful quote that you shared with me so many years ago. It's not what's the matter with you. It's what matters to you. Who are you? Are you a mother? Are you a train driver? I'm just looking at our gentleman with his cap because we did find out he was a train driver. How are you right here, right now? And then when the music comes on, when you've introduced to people that you are doing something different, you haven't come to take their bloods or to examine their heart or to give them the results of their tests, but you're simply going to put some music on and see what happens. So I think it's that beginning introduction which Kai talks about really beautifully as well in his writing. And if it turns out that we can't get Kai on board today, it would be really useful to put his blog up on the chat, because Kai has a beautiful way of describing the many, many stories he encounters, and at least we could gift that in this webinar. We have
just to jump in, Philippa, and say, just so you and Miranda are aware, you may not see the chat box, that Kai's tried every which way and it's just not going to be possible for him to join the session. So I really apologise. I'll find his blog and I'll pop that in the chat. And apologies for everybody. I'll jump off again.
Okay. Well, that is a real shame because Kai is just stunning. I know some of you will know him. Maybe we can try and find another time in one of the webinar series, because this is the first of 4 where we can bring Kai's voice in. So that beginning process is really about taking the time to notice, to attend in that way that Mary Oliver, the poet, talks about. It's not an attention that attempts to diagnose or give somebody a label in the way that you can stand underneath an oak tree and you don't need to know it's an oak tree. You just need to know it's a shelter in that moment. So similarly, when I work with patients, I don't need to know their diagnosis. I don't need to label them. I only need to find their humanness and then calibrate my humanness and begin our duet, our relationship for that moment. Does that make sense, Miranda?
Oh, absolutely it does.
Yeah.
I think there's a real difference between leading from the front and being with. And that for me is always the edge, that being able to be with in the lulls of not knowing where you're going to go, how this is going to unfold. And yet something in one's attention field is tuned to a sense. It's like seeing a human being as something, as a being in movement. There is movement there, even if we can't see it. As long as we're alive, there's movement. And there's something extraordinary, it seems to me, happens in that perception. Because I think there is a terrible stasis, that almost like you described with that man that you talked about at the beginning. There's a hideous stasis that can happen inside the experience of oneself in hospital.
Yeah.
So the moment music comes, you've got a movement in the air. There's a lilt that happens that just nudges up and allows someone to, I think you read that wonderful quote of unfolding. Beautiful feeling of unfolding. And it's, you when we've had conversations, you've also often said to me, well, people say, oh, what are you really doing? It's all just magic, isn't it? Or it's sort of somehow, what is it? It's no, I've got that bit of note in front of me. But it's not woo-woo. It's not It's very highly tuned listening and quality of presence that enables another person to emerge from the shell of the illness or the hospital experience.
I think that's really interesting because it really isn't whimsical. It's not fey.
No.
It's actually there's something about the quality of yielding to what needs to come out in the moment that is so strong, and that actually builds the building blocks for the person to figure out for themselves what they might need to do next. And so often these sessions can seem incredibly quiet. Somebody looking in would think I'm just holding somebody's hand. But there's so much information being shared in the holding of that hand. And of course, we work with touch. You're seeing in all of these images that we're working with touch. And of course, there's a lot of research done around dementia and Parkinson's and how the music and the movement will often reach places that other interventions can't. So the gentleman that you can see on the screen right now dancing with Acute, one of our art producers there, there was no speech. He wouldn't talk. He couldn't talk. Quite advanced dementia, but very chirpy, very well dressed, and he would sit and watch everybody going by and doing things. Sometimes he would take himself dancing down the ward, and that was when they said, "Can he come into one of your sessions?" Of course. What then happened was then not only did he spring up, dance, knew all the songs, he started this kind of really complex clicking with his hands and sounds with his mouth that were absolutely in tune with the song. He knew every single song, and he gave Acute an amazing dance round. And we had the great pleasure of working with him over 4 weeks. And it was very sad when he left. Obviously, it was good that he left. And for his wife, the fact that somebody on the ward recognized the charm, the engaged, beautiful man that he was, just brought her so much comfort. And that's the other side of this work, is that, yes, it happens on acute wards, but we have staff who need this work. We have families who need to see this work. And the more we can open the dance practice so that everybody can join in and feel that they have something to offer, young nurses, students, training, the richer the weave is in this work. Yeah,
absolutely. Because I mean, one of the things in a hospital is the degree of burnout among staff. So to be able to, and one of the remedies that people talk about with that is an arts practice, some kind of creative practice to help bring the joy back. Help sort of the work pressure is so intense that it is deeply needed. And it's both ordinary and extraordinary at the same time, isn't it? It's like, we know this, we know these vital things, for the joy, what matters for you. We know that, and yet it gets screened out with the pressure of particularly what staff are having to cope with in the NHS.
Yes, absolutely.
Very wide. It's not a dance artist in every hospital. It's a gang of dance artists.
Yes, no, absolutely. And I know, some places have that already. Great Ormond Street. I think there's somebody here from Gosh, and I always think like, oh, I just want to get on that train and join in with the team. And there's so many examples of practice, Lime Arts, Dawn, who has set up this extraordinary studio space specifically for staff, and specifically for staff that have struggled with burnout and are finding a way back in to continue the work, because we don't want to lose these people who are so skilled and so good at what they do. CUH Arts has actually begun in the last 5 months to develop a staff program here. So teams can order bespoke dance sessions. They can say to me, we'd like something relaxing, we'd like something team building or energizing. And I turn up on their wards, sometimes sometimes they can't, they have to be near the patients, but I'll have a small group of staff members and there's 1 or 2 patients in bed nearby, and the session is for them and for them only. And we've also, ACUA has developed a twilight session for staff once a month. And there was a beautiful young Turkish healthcare assistant who turned up at the last one. He said, it's really interesting because when he's in one of the bays, I always know the work's going to go well because he's so supportive. He closes the doors. He makes sure it's not busy for me. And then he turned up to one of these dance sessions and said, I've just watched you do this for so long, and I really wanted to do it for myself. So it's this lovely interaction between the two of us, and he was a great dancer. I really went for it. Yeah. Wonderful. Yeah. How are we doing on time?
What I was wondering is, not having Kai, would be good to know. There's lots more I could ask you, and there are lots more stories we could fall out of you. But I'm just wondering how many questions we've got on there. Lucy, are you there?
I am, yes. People have been very quiet at the moment on the question front. So if you have got a burning question, I know some people have had a little bit of challenge with the chat box and the accessing that. But if you do it in the Q&A, Annie and I can start compiling those. So if you wanted to potentially go through, have one or two more points, Miranda, and then we could move into questions.
Yes.
I mean, I think one of the things that, certainly Miranda has really led the way in allowing dance artists to work in health in this really important way. And there's more and more of us working in hospital settings. And it's something to be celebrated, it's still a lot of work needed, support for the dance artists. But also one of the pieces that's missing that Miranda, you and Kai and I have talked about a lot is patients will often come in to the hospital and discover this practice for the first time. And then they often say to me, or their families say to me, but what happens when I leave? How am I going to continue this work? And there was one lady, I'll just read another story, beautiful, strong, already had quite a strong music practice in her life. And she said to me, I've been really concerned about my healing. I've been questioning, am I going to be my old self again? And this, we had just done some movement together, this kind of let me know, yes, it's still in there. And I know what I can do about it. Maybe on a gentler scale, maybe not for as long or as active, but eventually I'm going to get there. It's made me remember that there's more in me. And then she said this, she said, I am so glad you made it before I left because I need to go home with this. And that just takes me back to what you said, Miranda, at the beginning of our ability to find this work, to organize ourselves to find this work in this way. When you began at the very beginning of our webinar together, the essence of helping people find what they have in them through this work, this listening work.
Yes. You used that word humor, and I think that's the most, I don't think any of us who are in this field approach as a dancer with all that flamboyance, but much more as I'm here with you and I hear you. It's with our presence. It's not necessarily said, but there's a quality of embodied presence that dancers have that I think help people settle. It's a bit like having a cat come and sitting on your lap. You drop out of the efforting and the having to manage your condition, having to meet the health agenda, into a being here, a being present, and that being enough. And I think one of the most interesting things in this, in the whole medical story of our culture, is that is what we call the placebo effect. And something like, I don't know what, I was trying to find this book that I had, The Human Effect in Medicine, written by Michael Dixon and Brian Sweeney, I think, about how relationship is what calls the health back in people, enables people to self-manage so much better. And it is, you mentioned it too, the group work, the being with others, that calling back of self, calling back of who you are in the huge experience of your life, because it is so diminishing being in an unfamiliar environment, being, having a treatment, things that make you feel so ill, nobody knowing who you are.
Yeah, absolutely. I mean, I think this work gives people respite. There's these words that we use. We're here to rehabilitate. We're here to help you with your recovery. The whole process of convalescence, that used to be people would go off to sanatoriums and have lengthy convalescence, months and weeks. We don't have that luxury anymore. But in these moments, people are given a break from the sense that they have something horribly wrong has happened. Something has broken in their lives. Some sense of who they are, the thread of who they are, has been disrupted. And we all know how sensitive we are to that in our own life. If somebody, your work finishes or something goes wrong with somebody who you love in your life, it really impacts on you. And in these moments, people can, things like pain, anxiety, low mood, anger, all of these things can somehow find their place. And there's more space to say, yes, you're all of that, but you're also that young girl who used to go dancing, or you're also that person who's right now sitting underneath that tree in Wales. And that is where your healing is coming from. And it's a lot about affirmation, this work. It's a lot about affirming, whereas, of course, you're in a hospital. A lot of the rest of the team is going, we really need to get that leg strong again. We really need to get your heart pressure. So there's a lot of people feel, there's a lot of pressure. There's a lot of pressure, and they've done something wrong to be there. And there's a lot of worry about being a bad patient. So this encouragement of expression, express how you are. It's fine to be a little bit tearful or a little bit angry or quite tearful or quite angry. We might need to put some really dramatic music on and let rip a little bit, so.
I'd love you to, I think one of the really important things in the skill base is the capacity not to be knocked off your pins by what you encounter. And I was going to, Kai had told me this story about being asked to go to this young man in ICU, in intensive care. His whole stomach was exposed. Nobody could get anywhere near him. He didn't want, he didn't want anybody to come. And he wasn't eating. It was in a sort of despair place, really. And I wanted Kai to tell that story because I thought, gosh, what would I have found that? But I'm going to ask you to tell a story that I found extraordinary about the young man with the two police officers chained to the chair.
Extraordinary. This was on neuro rehabilitation ward, and he was a young man who had been thrown into prison. And in the process of being in prison, he developed an illness which left the lower spine which paralyzed his legs. So he was in a wheelchair. And this is something that had happened to him during prison. So he was brought into the neurorehabilitation ward, a young man in his 20s, and he was constantly accompanied by 2 huge policemen in his room at night while he slept, when he woke up, when he went when he was toileted. These 2 policemen were there constantly. It was quite extraordinary. And I remember my first meeting with him is he was in his wheelchair watching television, and these 2 big policemen, and I walked past because I felt alarmed. I don't normally see policemen, especially on a neuro rehab ward. And then something just made me turn around, and I kind of leaned around and I said, "Hi, I'm Philippa, and I do the music and movement. Do you like music?" And he kind of looked at me, and yeah. So I said, okay. I'm thinking, oh my gosh, what am I going to do? What have I got myself into? Said, okay, well, let's go in there, which was just alongside the dining room. The policeman came in as well. It was terrifying, actually. But the magic was that it happened to be on that day, and this is a bit magical in terms of serendipity. There was a visiting dancer, a colleague of the head of arts at the time, Damien Hebron, who had come to see what dance in a hospital looks like. So it was the 3 of us. I said, are you all right to jump in with me on this one? It was the 3 of us, myself, this dancer, and this young man, and then the 2 policemen who had the grace to sit down at the back. And I just said, well, this is what it's going to look like. I'm going to put some music on. You're going to tell me if it's crap. And he did. He said, yeah, no, I'm not dancing to that. And I said, okay, well, what are we going to dance to? He chose some music. And I said, so basically, you're going to show us something and we're just going to follow you. And his eyes, receiving that information that I was saying, well, we're 2 dancers. We're just going to follow whatever you do. You like this song. You said you like this song. I immediately gave him responsibility. I immediately said, you're taking the lead on this one. There was no playing around with, oh, it's lovely to see you. It's just like, right, here we go. You chose this song. You said my music was crap. Let's go. What have you got? Put the music on. And his first gesture was he just brought his hands to his chest so fast, so powerful, and threw his arms up and then looked. And we were both there with him. And he just started to move this incredibly powerful, strong, and we were just breathless, keeping up. And then we just swapped. I said, okay, now you follow this guy. And now both of you are going to follow me. And we were just playing. We were just playing like puppies. We were just rolling. And it didn't matter if he was in a wheelchair. It didn't matter that he was coming from prison. We were dancers in that space. And again, it was transformative because up to that point, he'd refused to do any of the physio. I mean, he was seriously depressed, and the pressure on him and his life, as I got to know him, it turned out he had a girlfriend, a wife, who he hadn't allowed to come visit. For her to visit would be very, very complex. They lived far, far away, and he would often say, no, I don't want to see you. Anyway, a lot began to change. It was probably one of the most rewarding engagements I've ever had in my hospital time. And the pinnacle of it was constantly I'd be saying to him, look, you're a choreographer. Let's face it. You're not only a dancer, you choreograph. What you do is beautiful. And he would take me into dance. I'd follow best I could because he was quite an extraordinary dancer. He started to engage. His legs got stronger. Leg movement started to come into his dances. The pinnacle of it was he said to me, I would like to choreograph a dance for my wife, and I would like to perform it to her, just me and her. So we had to navigate that with the police. I said, if we stand just outside of the room, what could go wrong? I mean, it's not like he's going to run away. And they, I think in their own way, they were changing, but there's about 4 of them, and I did get to know them a little bit. In their own way, they were very moved by what was going on for this young man. We stood outside, almost like not listening, but just let them have their time together. And absolutely extraordinary that he performed, and he was so proud of himself. He also then began to draw, and none of us had realized what an extraordinary artist this was. It was like this just opened up his creativity in so many ways. Amazingly, about a year later, he walked back into the hospital to try and find me, and I was in the hospital at the time. Nobody found me to tell me that he was there. I don't have his contact details or anything, but that was a really extraordinary moment. Serendipitous that other dancer was there, but it was amazing what happened. Yeah.
Great.
Yeah.
That's rich work. I'm going to suggest that because we expected to have Kai, and so we planned it different, that we actually turn to guys out there and ask what are the areas you'd like us, having this experience here, what's the areas you'd like us to talk about more?
Miranda, we've actually got lots of questions after my call out for some questions. We've got lots. So I wonder, after that extraordinary story, Philippa, I'd heard part of that, but I hadn't heard the end of the gentleman wanting to come back. It's just been so lovely to have the storytelling, which has been so vibrant. And there's been some lovely comments about how powerful it is to hear those stories. So thank you both so much for sharing that. And apologies again that we couldn't get Kai back on the line. He's very apologetic and I'm sure would have added a lot of richness to this conversation. But let's move to the questions. I'm going to pass over to my colleague Annie, who has been fielding them, and she will start with our first question.
Hello, everyone. We've got a question from Kane John Mills. He says, please could you share about the training process you went through regarding getting into exploring facilitating dance within these acute kind of health-related settings? Thank you.
So I trained initially as a dance movement therapist at the Laban when it was still the Laban, over 30 years ago. And that was very, very useful in terms of understanding movement fundamentals, how in my toolbox is a lot of information on how you bring different qualities of movement through a body. So that was very useful at the time. It's a big part of my toolbox. A lot of my training has actually happened with Miranda Tufnell, who I would say is where I really learned about what it is, how it is to trust that listening space, that attending, the ability to work with anatomical improvisational. So I would say it's a mixture of practice, of setting up groups, of being a dance teacher for a very, very long time, working with bodies. I think here at CUH, there's been, nearly 10,000 patients have participated in this program. Having other ways of knowledge, anatomical bones, understanding things like contact improvisation, Feldenkrais, picking up knowledge and going into workshops where this somatic practice is taught. There's quite a few people here I know. We've got Penny Collinson is here, who ran the MA program in, remind me, Miranda.
Dance and somatic well-being program.
Dance and somatic well-being, yeah. So that kind of work, those kind of networks where we dancers have come together and worked together. Maybe, Miranda, if you talk a little bit more about the kind of workshops that you have been leading and devising.
Well, when I think about it, I'm not sure it's... thank you, it's very generous of you to say that about my work, but what I think is where we And I always say to people, start small. This is like, to take on a hospital if you haven't done a lot of, done some teaching, had some time to work with bodies who are not dancers, to run something in community. And that's the best teaching, I think, and learning that one can have. It's literally being with bodies, seeing how they need to move. It's not teaching something. It's listening for how movement might emerge through this particular body or that particular body. I mean, for myself, things I've trained as an Alexander teacher and a craniosacral therapist because I wanted my capacity to sense movement to deepen. I wanted to be able to really shapeshift into the body that was, I hate using this word body because I think what we do is not body, it's being. It's the body, soul, mind. It's all of it. But our physical body is the way in, is the portal into that deeper sense of self and being alive.
But I really understand your question, because I think it is frustrating that there isn't more training available for people who come from a dance training background, or in Penny's course, people were coming from nursing backgrounds. They were mature students, and it was that engagement with the body that they were seeking. And we really need a lot more of it. And we need placements in hospital settings, because that's the missing piece.
Yeah.
But it's a really good question. Thank you.
Very important question.
That was a really interesting insight. Thank you very much. We've got a question from Philomena. She says, I've worked in mental health and freelance as a psychotherapist first, and in the past 3 years freelance as a somatic movement dance practitioner in community and health settings as a passing visitor. However, I'm just preparing a proposition for a local hospital in the hope to enter the environment and work from within it. Do you have any advice on how to present this practice to settings where it doesn't already exist, or it's quite alien actually?
Yeah, I mean, I had to put in a very clear proposal for what I meant, because I created this position here 10 years ago alongside the head of arts, and we had to think quite carefully about, is it a residency? Is it a project? Is it performative? Is it about co-creation? So in one of the later webinars, Lucinda Jarrett will be talking, who does a lot of kind of work that is more around devising, co-creating. So I think for me, it was very important to find a few key people who understood enough of the work to help me do the translating. And then just be very clear, this is going to be a pilot, 6 weeks, and we're just going to, as Miranda says, take it down to small building blocks. We're just going to see what it's like to change the environment in this ward. We're going to bring in music and other listening bodies. As simple as that.
Yeah, I mean, I absolutely agree. It's keeping it simple and not thinking the hospital. But
no, it's too much.
It's naming certain things that where our languages overlap, which is breathing more easily, managing pain through relaxation and movement. Well, it's having very, very clear languaging of what one might want to do. When I was working in the NHS in Cumbria, we called it the breath of fresh air, and we asked people. We said to people, we'd never mentioned the word dance because that would have, can't even move, let alone dance. We could have got that. We said, come and find new ways to breathe and manage pain and relax. I mean, relaxation is crucially important.
Absolutely.
Movement enables, movement enables a relaxation.
Yeah.
And then the whole healing process, whatever the medical team are doing, it really connects in. I remember a nurse saying to me once, I can't manage to give this person their injection because they're so tense, they're so braced and in fear. And that's what our work was done, was to down, losing my words now, retune it so that the woman was able to take her treatment. So it's, I think those words like help patients reduce relaxation and breathing and reducing the efforting.
Find the team that is perhaps most going to be able to understand. Yeah. So, for example, on the pediatric wards, I'm working with the play workers. On the stroke ward, I'm working primarily with the physiotherapists. So there's already a kind of a shared goal there in those different, which really helps bring something that might initially feel alien and different, but people, once they see you doing it, will go, oh, I can really see what you're doing there. And then the conversations begin.
Yes, I mean, if one has one lead into one hospital world, one lead in, and then that leads to another, it is about creating the bridge so that the work can come in.
Creating the bridge, yeah. I hope that's helpful.
Yeah.
That was really interesting. Thank you. We have another question from Sarah. She says, thank you for such a powerful description and reflection of your work, Philippa. I noticed in the photos that other people, staff ? Are joining in. How does this work impact on their perspectives and who they are working with and the medical work they need to do?
Thank you, Sarah. That's such an important question, and thank you for saying that. Before COVID, all the sessions were group sessions because we thought at the time that was the best way of bringing this practice into the hospital. And an absolutely vital part of that, and maybe this will help the previous question as well, was that the sessions were devised and structured so that they could be as inclusive as possible. So that nurses could come in, healthcare assistants could come in, trainee student nurses could come in, and sometimes even trainee medical doctors could come in, rarer, but we're getting there slowly. And the idea was for them to be able to join in and not feel that I was a professional specialist, possibly about to do something really alarmingly sort of sophisticated like pirouette, but that actually what I was inviting them to do was to just be comfortably sat in their chairs, to take somebody else's hands, their patient's hands. And one of the most rewarding parts of that group work was the way it not only gave the staff a chance for themselves to self-regulate their pressure. Often a patient would start to weep or share something, and you could see them tearing up as well. And this is something Miranda really highlighted just the other week, is the importance of bringing feeling back into this territory. We had a trainee nurse last week join our dementia group, which Catherine Pride is going to be talking about in one of the webinars. And at the end of it, she just said, but this was so emotional. You were all so emotional. And how come you're allowed to be so emotional? I've been told that I'm not allowed to be emotional. And we were really quite bewildered and really worried for her. Yes, Chico was there in the session because, of course, these sessions are emotional. We're emotional beings. So it was, I hope, a turning point for her. She was feeling very, very depressed by the fact that she had been caught out being emotional. So I think it not only gives staff a chance to get something for themselves, but it also really helps them understand their patients and build a relationship in a different way. And one of the very early films we made here at CUH was around It's Something Different. And it's mostly the staff saying, I now see my patients differently. I am now able to help my patients in the way I would want my own family to be helped. So not only does it bring the personal in, it strengthens those relationships that are so key. We're humans helping each other. So I hope that helps a little bit answer that question.
Great.
Thank you very much. I think we've got time for one more question. We've got one from Lucy who says, I'm really interested in the language you use when approaching patients. You offer music and movement, not dance, question mark. Do you think this makes it easier for people to engage? Is dance too scary a word?
Well, you see, the thing is, I'm not wearing scrubs, so I look like a doctor. I've got one of these dangly things. And so when I approach people, they often look very hopefully like maybe the doctor's arrived. And then I go, well, no, I'm a dancer. And some people just look terrified, especially the younger men on neuro rehab, like, oh my God, not only am I in hospital, but now my mum's turned up and wants to dance with me. Some people look absolutely excited, like, well, yeah, of course, great, let's do it, let's go. I have found it more helpful over the years to say music and movement. It's softer, but my main goal with using music and movement was that I was trying to model that for the staff so that they wouldn't hype up the dance session, which was really difficult to sort of be announced as the dancer who was going to make everything okay. Whereas now the staff will say, oh, well, what she does, I can hear them. She just puts really gentle music on and then you can do what you feel you need to do. And I think that's a more accurate description for people as to what happens. As far as I'm concerned, my dance practice, Miranda's, Kai's, a lot of the people here, our dance practice is about this listening to ourselves, particularly in relationship to the environment, in relationship to one another, and to notice these weathers that come through us and how we navigate and how we fathom. That's what dance means to me. I mean, I love going out on a Friday night and doing my thing, stomping my stomp, getting the disco ball out. But it's important that we really show the continuum. Interestingly, the physiotherapists on the pediatric ward were very excited. We did a pilot and we called it Disco Tuesdays, where they actually got a disco ball to emphasize this really was a disco. And their idea was to try and get all the parents out and moving, sometimes just in the threshold of their doors if they were barriered, to get the young children moving. Because one of the great difficulties, and we will be talking about this with Lisa Dowler, extraordinary practitioner who works at Alder Hey, who really established dance there with children's wards, is the pain issue. Parents will often feel like they don't want their child to move. Children will often feel they don't want to move because of fear of pain. But the deterioration, the muscle deterioration, the deconditioning is alarming with tiny bodies that are pumped full of chemicals. So that was their attempt. And actually it completely worked. The disco term, the dance, it worked. They all loved it. Everybody came out. We had a young lad who was a paraplegic, couldn't move, had a tumor on his back, but he was a DJ with such a wonderful sense of humor. He would put things on, like he would request I'm Still Standing by Elton John, Green Green Grass by George Ezra, which is all about the day I die, this is what I want you all to be doing, dance. So there's a lot of humor in this work and a lot of love. And yeah, those discos, we're dancing. Yeah.